So for today's video, we are going to tackle about burns. Burns is an injury to the skin or other organic tissue primarily caused by heat or due to radiation, electricity, friction, or contact with chemicals. All we know that whether we work in a commercial kitchen or we prepare daily meals at home, kitchen burn accidents are a common hazard. And accidentally grabbing a valve in a moment of panic or sleeping while holding containers can both lead to containers splashing hot liquid. Dancing is usually associated with a joyous, non-stressful event, exactly what cooking in the kitchen must be. Cooking fills the soul with warmth and satisfaction, just as dancing does. We can't deny, especially in our generation, that dancing is scientifically proven that helps promote bonding, builds social connections, releases endorphins and other feel-good hormones, and it provides an easy way to fit some extra exercise into our daily day. But do you know the negative consequences of dancing while you're cooking? So this is what I'm talking about. At home, the kitchen are the most common places for burn accidents such as scalding. A scald is a type of a burn caused by a hot liquid or steam. They are one of the most frequent types of burns. When a situation happens like this, classified first, second, and third depending on their depth, not on the amount of pain or the external of the burn. Always remember that first-degree burn involves only outer layer of the skin. Skin is dry, painful, and sensitive to touch. Example, it looks like a mild sunburn. And second-degree burn involves several layers of the skin and it becomes swollen, floppy, weepy, and blistered. Assess the situation quickly and calmly. Protect yourself and the victims for any danger.
Hey, what happened? I am Rana Bulima, a volunteer first aider.
Prevent infection between you and the victim. Comfort and reassure. Assess the casualty and perform first aid. If you notice, the client said a while ago, she is going to put on the burned area with ice, but it is definitely wrong. Cool the burned area with cold and not ice water. Cold water is the best immediate treatment for minor burns. The cold lowers the skin temperature and lessens the severity of the burn. Do not use ice because it may further damage the injured skin. Always remember, before performing a first aid into your client, wash your hand first. Do not touch the wound with your hands or any unsterile objects.
Make sure to elevate the hand of the patient above the heart level.
Do not break blisters that may develop. If the blister breaks, clean the area by running tap water over it, then apply an antibiotic ointment.
Do not touch the wound with your hands or any non-sterile objects. Do not put butter, grease, toothpaste, or any oil. They will increase the risk of infection. Make sure to elevate the hand of the patient above heart level. Leave the burn area alone for 24 hours. Do not cover the burn unless clothing rubs on it. If it rubs, cover it with a gauze pad taped well away from the burn. Remove the dressing every day and clean the wound and cover it again.
In the first-degree burn, it involves only outer layer of the skin, while the second-degree burn involves several layers of the skin and the skin becomes swollen, puffy, weepy, or blistered. For the third-degree burn, it involves all layers of the skin and may include any underlying tissue or organs. To sum it all, here are the first aid tips. To stop the burning process, first you need to do all cool the wound, and this can be done simply by running it under cold water for 5 minutes or more if necessary. Then you need to cover the burn with sterile non-stick bandage and secure it. Thirdly, make sure you seek medical attention as soon as possible after you have treated the burn.